Hello everyone, welcome to Shining 3D's Digital Dental World. Today, we'll bring a new case to share with you. We are very honored if this could be able to inspire you a little bit about your clinical work. We all know that it is a general tendency for the dental diagnostic and treatment industry to move from traditional era to digital and modern one. Digital technology enables pre-implantation image analysis, virtual implant planning, guidance plate design and manufacture, implant aesthetic design and modeling editing to be widely used in diagnostic and clinical treatment, making it possible to achieve high precision, long-term stability, and foster real aesthetic implant restorations of anterior teeth. Shining 3D is fortunate enough to be involved in making this happen. Although our intraoral scanner, OptiScan desktop scanner, Acrofab 3D printer, dental cloud platform, we work with doctors and technicians to provide patients with better products, service, diagnostics, and treatment experience, making the whole process more smooth and accurate. Many thanks to today's case providers, Dr. ABDL Roman Kraf and Dr. Kyrilos Henley, a very successful case of implant aesthetics in anterior area. This patient has one missing due to trauma, labial bone resorption resulting in insufficient bone mass, and gingival recession. Reducing trauma, restoring defects, reconstructing soft and hard tissues, and obtaining long-term good aesthetic results are the goals of the treatment. First, by using our Scan 3, the two dentists obtained the patient's full arch date. Then they combined the data with CBCT. Through the implant planning software, they carried out a personalized implant planning to guide the surgery according to the patient's oral bone volume, and jaw teeth, the position, direction, and the depth of the body implantation. All this information will be integrated and output a guide plate to help dentists to realize their implant planning. Accurate plan and precise plate guide is very important, which determines the therapeutic effect in some degree. The implant position and depth will affect the fullness and aesthetics of the soft tissue around the implant body, which in turn affects the aesthetic of restoration. Therefore, it is necessary to control distance between the implant and the natural root surface, as well as with other implants in a reasonable way, and the thickness of labral maxillary bone plate as well. Accurate guide plate is a prerequisite and foundation to realize the pre-operative planning. Shining 3D do well which can satisfy clinical use completely. The guide plate fits good. Under the precise guidance of the implant guidance plate, Dr. FTE Roman Karev and Dr. Kyrilos Henley completed the implant surgery according to the established plan, and the implant placement position was exactly as expected. In addition, due to the insufficient bone volume around the implant, the doctor accomplished the bone augmentation surgery on the labial bone plate simultaneously to ensure the long-term stability of the implant and the aesthetic effect of the post-implant restoration. Here the photos shows the position and the angle of the implant body virtually compared with the reality. The planning has been carried out perfectly. When the soft tissue around the implant was plump, the color and the texture of the gingiva were normal, no swallow, the invergence profile margin was formed. Dr. Abdiel Rahman Karaf and Dr. Kyrilos Henley used the intraoral scan 3 to collect intraoral data directly. The intraoral scanner here helps the dentist to get rid of physical impression, which may time costs, inaccurate, and cumbersome. The restoration design was completed using ExcelCAD, and the model was printed out by Acrofab device. All the details of the design can be adjusted on the software. Technicians can try different parameters to make the final restoration with suitable form. The AccuFab D1S can print out the physical model 100% to its digital date within 1 hour. Dentists should try the model to ensure the final gold restoration effect. Those are photos to show the final prosthesis being put into the patient's mouth. The prosthesis was full-seated and matched exactly with the implant. The labial side achieved a very good aesthetic effect. Dr. Anterior and Dr. Carlos Henning were very satisfied with this case. The AccuFab printer and Aeroscan 3 of Shine 3D is very helpful for fulfilling the planning of the operation and their expectation of the treatment effect. As an equipment supplier, we are glad that Shining 3D's products and services can make the digital diagnostic more smooth and comfortable, achieve better treatment results. If you, in front of the screen, want to improve the whole process and eager to experience clinical diagnostic and treatment through digital technology, Shining 3D is willing to work with you together to create a future of digital dentistry. Thank you very much.